Hi, welcome to yet another podcast. Today, we have with us Dr. Sadhana Sathye, who is a pharmacologist working with the Institute of Chemical Technology, which was earlier referred to as UDCT, a premier institute in India. She's working as a professor. Welcome to our podcast, ma'am. Thank you for taking your time off and spend time with us. Thank you once
Thank
again.
you. Thank you. It's my pleasure.
She's been doing a lot of experiments and projects. She has to her credit several patient education manuals, nurse training manuals, to which the patients and the caregivers depend on. They use it as their Bible. She's associated with several pharma companies like Abbott, Merck, Glenmark. The list is long. She's a consultant to the pharmaceutical industry in India for planning, implementation, execution of preclinical and clinical studies. She's currently involved in evaluating herbal drugs for their anti diabetic activity. Furthermore, she's also doing research on developing dietary health supplements from herbal origin to treat epilepsy, Parkinsonism, and Alzheimer's. There is so much more that I could tell you about her, but I think I would expect you to learn a little bit more when we have our conversation with one another. So, doctor, what made you take up pharmacology?
Uh, when I was doing my B Farm, there were about four major branches, which anybody could pick up. This pharma field is very huge. So, pharmacology essentially means mechanism of actions of drugs, how the drugs work, how do they produce their side effects, whether there are any interactions when you took many drugs together. Now, many drugs meaning particularly a patient who is uh, suffering from hypertension, he would take diuretics. Maybe that hypertension is because of diabetes, so he would take anti-diabetic drugs. So when you take so many drugs together, would that affect activity of the drugs when taken together? So this always interested me, and more than that, what interested me was herbal traditional knowledge, the Ayurvedic texts, as well as the folklore medications, which are well known to all of us in India. So my grandmother would just, we would never go to a doctor. Any small problem, she would say, "Oh, take this or take that. You have acidity, okay, take this. You have fever, okay, take this." So it was never, we never went to a doctor, and that's what you know started. I mean, my mind started. Let me explore this whether it's really true, because I had that pharmacy knowledge. Whether I can endorse these activities as per modern medicinal methods, then anybody would believe that to use it as a practice. So that's what took me to pharmacology. Otherwise, there are different other fields wherein you synthesize the chemicals as a pharmacist, or you make formulations. I mean, you make tablets or capsules or syrups. So that's another field. But this interested me more because of my interest in human physiology and the traditional medicines working on that.
So, these traditional medicines that you mentioned, all of us are familiar with it. That's also called home remedies.
Home remedies, actually.
Yes? Yeah.
They are home remedies.
So,
And not
खांसी
only
हुई है,
medicines as such,
हाँ,
also nutritional substances. Because we get so much from food. So whether can we use food to take care of our some of our problems, some of our imbalances? See, diseases are not actually diseases unless you have infections by other microorganisms. They are just imbalances in your physiology. So because we have knowledge of physiology, and I started exploring the food substances also, it became very easy for me to correlate for using any kind of food substance in any of our, you don't say diseases, we would say disorders. So something like acidity or liver malfunctioning.
I see. No, it's of now that you're saying that these are imbalances and things like that. How does epilepsy feature in this?
So, that's also an imbalance. So, what happens in the brain? There are two kinds of neurotransmitters. One is glutamate and one is gamma amino butyric acid. So, glutamic acid and butyric acid, they are in balance with each other. And trust me, glutamate or glutamic acid is an excitatory one. GABA is an inhibitory one. So both of them balance each other. And glutamate, when it gets metabolized in the brain, it becomes GABA. GABA, when it gets metabolized, it becomes glutamate. So body itself has this balance maintaining activity. And when the GABA goes down, really goes down for whatever reasons, then you have epileptic attack or fits, as we call it. So there is a very high activity in the brain neuronal cells, and that's what leads to epilepsy.
I see. So
It's an imbalance.
what does your research tell you about this? How does one treat it
Yes,
with the
yes.
herbal medicines?
So what we do is we try and understand. Um, See, now we also see what enzyme converts GABA to glutamate. So if we could inhibit that, that's a good idea. And what happens is once glutamate is very high, the neuronal cells, they literally start dying out. They become so active that they can't take up that much of activity and they die. They just, and one cell even dies in the brain, it produces so many inflammatory substances that it picks up the other cell, and so the disease becomes progressive. So a person gets an epileptic focus in his brain. So you may have heard somebody suffering from an accident and getting a trauma, head trauma, and that leads to death of certain neurons, and then that leads to these neurons may be GABA producing neurons, which are inhibiting the brain activity, and then that focus gets generated. Then he starts getting epilepsies whenever, like you don't know. So whenever there's an overactivity, he starts getting it. And that's all because of the degeneration of a particular part of the brain, breaking up of the neuronal cells in a particular part of
So
the brain.
which herbal medicines
So
are
basically, we have explored eclipta or maca. Maca oil, people use it for this, what you say, hair growth and baldness. So this maca, it is reported in Ayurvedic literature that when you crush the leaves of maca and put the juice into the nostrils, epilepsies get cured. So that was the reported literature from where we started, and we extracted maca leaves, and from that we got luteolin, which is a antioxidant substance. It's a flavonoid, and we got a coumarin, another antioxidant substance, which is vedilolactone, and that works wonderfully in delaying the latency. Meaning, what happens? Epileptic attacks a person gets, but if you could increase
delay?
the time between two epilepsies, that also gives relief to the patient. And when you have increased latency or increased time between two epilepsies, that that slowly reduces the progression. So reducing progression is very, very important. So we've done that, and we have published these papers also. We have even patented a formulation of vedilolactone, nasal formulation for treatment of epilepsy. And one more interesting thing is ajwain, thymol.
Uh-huh.
The important constituent of ajwain, that is thymol, it's an excellent remedy for epilepsies. But the problem is that you can't make formulations of thymol. because the minute you take it, it just goes away. It gets hydrolyzed in the body. But as ajwain oil, it can be taken up by the body and it can be used by the body. So
I
there are
see.
certain very interesting things about uh, all this research.
Now, you will have to tell me more about Parkinsonism. Now, people would want to know.
Yes, yes. Again, now Parkinson's also,
Yeah.
there is a degeneration, again imbalance. Not in a hippocampal area as epilepsy is. This is little behind. This is in the substantia nigra area. So a little behind of hippocampus is this area where you have this dopaminergic neurons. Now, dopamine is a neurotransmitter, and exactly opposite to dopamine is something called as acetylcholine. So, maybe your students are too young to understand that, but trust me that these two chemicals, dopamine and acetylcholine, they are exactly opposite to each other. Which way? So, if dopamine increases the heart rate, acetylcholine will decrease the heart rate. If acetylcholine increases the muscle contraction, dopamine will decrease the muscle contraction. So, what happens in Parkinson's is that in that substantia nigra area, the dopaminergic neurons they die. They die. Now, why they die? Either there could be a genetic influence, point number one. If it is not genetic influence, it could be even pesticides that we inhale, the mosquito sprays or the pesticides which are sprayed on the food substances that we ingest. They are lipophilic, so they get into our body and they can easily go to the brain because they are lipophilic. They are lipid soluble. And that's what degenerates, that has got a capacity to degenerate the dopaminergic neurons. And once that happens, then you start getting uncontrolled contractions which are otherwise controlled by dopamine. So this is what happens in Parkinson's. So again, we have to arrest the neurodegeneration. We have to see to it that dopamine is produced again. So dopamine producing cells we have to increase in the brain. So that's how we try and control Parkinson's for that matter.
So, any herbal medicine that you recommend for Parkinson's? Just as
Yes,
you have the mocha leaves and the ajwain oil for
yes,
Alzheimer's?
yes.
Sorry,
So,
not Alzheimer's, for
so
epilepsy.
epilepsy. So what I would suggest is luteolin. Luteolin is the chemical which shows a very good activity in Parkinson's. So those who can afford to buy it, you get those capsules on Amazon. Of course, we are also trying to develop the formulation in a better manner, but that those capsules are there, nutritional supplements in the market. That is one. Otherwise, you can have celery extract. Luteolin is present in, or you can have coriander juice. So coriander juice has got lot of luteolin. So you could just crush coriander, but fresh. Huh? Don't allow it to stand or something. Just take fresh coriander, add a little lime juice, squeeze it, I mean, crush it, squeeze it, and drink it. And you don't need lots. You don't need lots. You just need about 10 to 20 ml. Every day you can have that. That will give you a good amount of folic acid, chlorophyll, plus luteolin. That works wonderfully. Other thing that you can have is tulsi leaves extract. So there is one more active in tulsi which is called as ursolic acid. Ursolic acid. So that's wonderful remedy for Parkinson's. You could just, eat 4 to 5 tulsi leaves every day just to prevent. See, and prophylaxis is extremely important than treatment because when you get Parkinson's symptoms, you have already started degeneration. So, to arrest that degeneration, I would suggest you take luteolin capsules at that level. But at our level, just to remain healthy, you could just pluck 4 or 5 tulsi leaves and eat it. That's it. You
But
don't need lots, you just need a little amount of it.
I had heard that tulsi leaves are not to be eaten like that.
No.
No.
It's okay,
Okay.
yeah.
Now that
In
leaves
fact, what
me.
I do now,
Yes.
I betel leaf we eat, meaning I don't know, but I like to eat betel leaf, vidyacha pan.
Yeah.
Okay, so in that only I put tulsi leaves. I put a little body shape or something and eat it as such.
Oh,
So it doesn't, it is not at all arid. It's nicely aromatic.
I see.
And just four
Good.
or five leaves is good enough for all of us.
Okay.
That stimulates the immune also. Meaning apart from that, meaning apart from having ursolic acid working for Parkinson's, it works as a what you say immunostimulant. More than that, this tulsi and this luteolin, meaning ursolic acid and luteolin, they have shown increase in dopamine producing cells. We have published these papers.
I see.
So it works. Now, all that is we have to make better formulations and uh,
And the
try
people
and
need
market.
to know. People need to know.
They need to know definitely. In fact, I'll tell you something. I have one friend whose husband, 55 years old, he started suffering from Parkinson's. And then I gave him luteolin capsules, 100 milligrams. I said, you take it. And he was so bad that he had to do some surgery. There is an electrode which is placed in
Chip.
your,
They put
yeah,
a
there's a
chip.
chip,
Yeah.
yeah, and that stimulates the neuronal cells. So that electric current you have to monitor, meaning the surgeon has to do that. So after taking luteolin, his requirement for this current has reduced considerably. So meaning what I want to say is he was diagnosed as Parkinson's to such an extent that dopa and levodopa, the common medications
Yes.
that are used, he was beyond that. He needed that deep brain stimulation as well. So that intensity reduced after he started taking luteolin. So I told that friend of mine that don't worry, it is not going to get cured tomorrow. But because it's a muscle disorder, I told her to do physiotherapy also. So that the muscle contractions, they happen in a proper way. These are uncontrolled. In Parkinson's, the contractions are uncontrolled. That's because dopa is less. Dopamine is less. So that's how you treat it both ways.
I see.
Make them exercise, give them good food, and the nutritional supplements if needed, and you can control. And trust me, the commercially available medications, though I'm a pharmacologist, they have the capacity to, prevent muscular activity. Meaning levodopa and carbidopa, the medications which are used to treat Parkinson's, they produce something called as dyskinesia, meaning the patient's ability to walk completely goes down. There is difficult walking, distressed walking, the posture stoops, typical muscular issues. So you have to talk to the patient, counsel him, say life is beautiful, and then give him nutritional supplements, give him good food to eat, make him work out. Things will change slowly.
Interesting.
Yeah, it is. It is. It's very interesting. Yeah,
So I have one more question.
sure.
Now, the thing is, I was told that Bale Murabba, if one were to have that on a regular basis, it's
Yeah,
good
yeah.
for Alzheimer's. Is that so?
I mean, I have not really looked into what is Bale Muramba and what does it. But Purnima told me that my her. So she told me that Bale Muramba works for Alzheimer's. So can you just hold on? I'll just check what Bale contains in that
No,
thing.
it doesn't matter. The thing is,
Huh.
what I was trying to tell you is that the so-called um, home remedies or grandmother's remedies,
Yes.
there seems to be some truth in it.
100% they have, because that's how they have uh, understood about these medications. I have opened a Google, so I'll just check if I could find
Okay.
something. I'll let you know right away that the fruit.
But there is also a general fear among the people that the
See, it has
so-called,
got lot of flavonoids in it. So
okay,
antioxidants are there.
okay,
I'll tell you, see, again, Alzheimer's, now, when you talk of Alzheimer's, it's also a disease of neurodegeneration.
okay,
Again, a different part in the brain that degenerates. And this time it is cholinergic neurons. Like in Parkinson's, it is the dopaminergic neurons.
okay,
They die and colon becomes more. In Alzheimer's, it is the cholinergic neurons, they die. And that's how the cholinergic neurons are responsible for taking in the impulses from the instructions from the brain to the body. They are lost, of body to the brain, they are lost. So you need, see, any kind of cellular degeneration, you leads to lot of oxidative damage.
yeah,
You maybe if you have heard of reactive oxygen species, meaning oxygen whose last octet, last shell is
yes,
incomplete. The electrons are not enough. So they pull electrons from neighboring cell. And when
correct.
they pull electron from neighboring cell, the neighboring cell dies. So all these diseases, one cell dies now, lot of reactive oxygen species come up, and that's how the disease becomes progressive. So if you give something like flavonoids, which I can see it's there in bale muramba, that picks up all the reactive oxygen species and it hinders the cellular degeneration and progression of the disease.
I
So
see. But
that
there is
mechanism.
also a general feeling,
Hmm.
Dr. Sathe, that the so-called herbal medicines do not undergo a very rigorous qualitative research, and there is no quality control.
No, no, no. I don't agree with no quality control, but I agree with no quality research. There is no quality research. That's when, see, what happens. It's not easy. When I take an extract, I like I told you about maca. There were 15 other things in that. So which is active? I need to separate all of them. So now there are methods as to how you go about it
Mhm.
and how you map it. So you can separate them from there, or you know the chemicals which are there because you can map them. And once you map them, you try each and every chemical how it works. So quality research is very important. And as far as quality is concerned, you are right. Now, supposing today I take Eclipta from Konkan region, tomorrow I take it from Kolhapur, then I take it from Gujarat. Are all these plants, do they have the same kind of
Constituents.
chemical constituents? You have to look into that. You have to prove that if I take it from, or don't prove anything, say that my preparation will contain 1, 2, 3, 4, and that's why my preparation is a good preparation. Even if you do that, FDA allows that. Meaning you have to show that at least 4 constituents are there, whatever that you're talking from the plant, that you have to show.
Do these so-called big pharma companies, do
Hmm.
they get into these herbal medicines also?
They don't get into herbal medicine just such because the regulations are different.
I
So
see.
they'll come into nutritional supplements.
Ah,
So that's a separate category that you have to look even when you Google. So they don't call it a drug, they call it a nutritional supplement. The rules are little different, little less stringent than what are there for drugs because drug is taken as a what you say substance that could produce toxicity. So for drug toxicity regulations are very different, difficult, stringent. Whereas for nutritional supplements, they are not so. So
I see.
we can work in this area, meaning we pharmacists who like to do pharmacology and who like to address concerns of disorders. So this could be a good area. So me and Purnima, both of us, we work together somehow many
I
times
see.
because she's the one who will make it into a formulation like a capsule or a tablet or a syrup, and I'm the one who will explore it. That okay, it has got XYZ number of constituents, and this works on this and this works on this. So she's saying, okay, let's now take it ahead.
Okay.
So even as a nutritional supplement, you have to make it into either a capsule or a tablet or whatever forms. New forms you must have seen, you get those um, papers also. You could just put it in your mouth and they dissolve it in the mouth. So
So
many other aspects of it is there.
we've had a very interesting conversation and we've spent more than 20 minutes.
Okay.
The time has just flown by.
Yeah.
We've had a very, very interesting conversation. And thank you very much for spending this time and giving us this invaluable input and
Thank
a
you.
bird's eye view of the grandmother's recipes, the grandmother's
Yeah,
remedies. I'm sure the parents will, the
yeah,
audience, the
and my
people who are
appeal to
listening in,
them, if at all they know any such remedies, please let me know. I can explore it for them because there would be many.
I'm sure there are.
There
The
would be.
so-called Kada.
Kada, we are exploring the Kada right now. We are exploring it for COVID because it
Really?
worked very well. Yeah.
Really?
So yeah, it worked very well. I have literally cured so many patients with only freshly prepared Kada. So now everybody wouldn't have time to freshly prepare it. People like me rather wouldn't have time. So can we have a spray dried powder? So me and Punima are working on that.
I
So when
see.
you spray dry that, do
Ah.
any of the constituents go away from that? So that's what we are
Is
searching.
the value of that, does it come down?
And it shouldn't come down. Can we do something for that? How can we do that?
Excellent. This has really been a very, very interesting interview that I've ever had.
So something like you and me, we are busy and
Yes.
we have some problems, maybe infection. Just cut a pouch, put it in a glass of water and drink it, rather than making it and
Yeah,
straining it.
that would be
And
nice. That would be
let's
nice.
hope
It would really
it
bring
comes.
down the pressures.
Literally, I'm telling you.
Thank
And
you
you'll
very
find
much.
healthy society, with this.
That's true. That's true. It's very, very true.
Okay.
Thank you very
It was
much.
nice, yeah.
This brings us to the end of the podcast. I can't thank you enough. This
Thank you
has
so
really
much.
been
It's my
really,
pleasure.
really been a very, very interesting talk.
Thank you. Thank you.
Thank you so much.